If you're having a hard time finding a pediatrician in Winnipeg, chances are you're not alone. This is pediatrician Dr. Ruth Grimes. She's been practicing in Manitoba for nearly 3 decades. Here's what she had to say.
Unless the family is already connected with a pediatrician because of previous siblings, I think the likelihood of finding a pediatrician for well, newborn and child care is going to be slim to none unless pediatricians happen to have openings as older patients graduate.
Grimes says traditionally, pediatricians here have provided primary care, including newborn checkup or for health concerns like a cold. But she says things are changing. She says in other parts of the country, pediatricians spend more time providing care and consulting for children with complex medical needs. And that's something she's also seen happen more here. Grimes says medical advancements mean more premature babies are surviving and children with complex medical issues are living longer. And there's other factors too. She says she started seeing more consults for mental health care when the COVID-19 pandemic hit. And she points to the retirement of at least 5 pediatricians in the last year. Grimes thinks family physicians and nurse practitioners need to be a part of a new pediatric primary care model in this province, but acknowledges family physicians are stretched thin too.
This is, I think, a natural evolution over time, but it is now creating a crisis, because we also know that there are not family physicians to take on any patients, regardless of the age.
The head of Doctors Manitoba says this is another symptom of the physician shortage here.
Pediatricians that are still doing primary care are overloaded, overworked, their patient rosters expanding. Family physicians that are doing it feel like they just can't take more.
Dr. Michael Borditsky says Doctors Manitoba continues to push for recruitment and retention plans for doctors. He also wants to assure families that family physicians are trained to provide care for kids and babies. And Doctors Manitoba says starting April 1st, a new funding model includes incentives for family physicians taking on babies and children. Grimes wants families to know pediatricians want to make sure every child has access to a pediatrician for specialized care if they need it. Alana Cole, CBC News, Winnipeg.